Hi, so this presentation is to basically talk about whether or not you think that the US could have helped limit the spread of COVID-19 a bit better from the start. And what I'm trying to do here is more so give people their own opinion that are viewing this rather than state my own opinion, but I definitely do a little bit. So, we probably all know what COVID-19 is, but of course, I did put it in because I felt it was necessary. So, COVID-19 is an infectious disease caused by a newly discovered virus. Of course, we know that because we all have to be asked if we've had any symptoms of it very, very often, especially when we go to the doctor's office. And the WHO states that most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory illness, and cancer are more likely to develop serious illness. And according to WHO, COVID-19 has currently caused more than 2.8 million deaths worldwide, which it does sound like a lot. And in my opinion, it is a lot. But when you do look at the percentage of people that it has killed, it doesn't actually sound that bad. But when you think about 2.8 million deaths worldwide in a little over a year, that sounds like insanity to me. It sounds like quite a bit. And the older you are, the more that your risk for death from it increases. So, some things to think about. So, COVID-19 began in Wuhan, China. I don't know if some of you remember, but I remember being at work and going out and cleaning this area where the news was always playing, and all I heard was COVID-19 in China, and it was almost every night, and I would roll my eyes and think, okay, I get it, there's COVID in China, and I was thinking, well, we probably don't have to worry about it here, it doesn't sound that bad, but here we are. So, it started, the first person to test positive for it was on December 8th in Wuhan, China. Soon after, on December 31st, China reported the first 41 cases of COVID-19 to the World Health Organization. On January 9th, the World Health Organization released a statement regarding the identification of the coronavirus. So they did make people aware shortly after. I guess it was a month. Maybe it was a little long, depending on how many people had tested positive on December 8th. January 11th, the first COVID-related death was in Wuhan. And January 23rd, 2020, Wuhan goes into lockdown. And I don't mention that later on, but I do mention it now because it's interesting. I don't even think I have it up here, but Wuhan went into lockdown, and it seemed to have helped because Wuhan ended up with less cases than the United States. I believe they still have less cases than the United States. So it seems like that tactic had worked. Maybe I'll edit that and mention it with my final draft. So the beginning of COVID within the United States. So the CDC implemented public health screenings at airports in San Francisco, New York City, and Los Angeles. At this point, there were no recorded cases of COVID-19 in the U.S., and I think this is a good thing that they did because they did try to prevent it from spreading. The first case of COVID was recorded in Washington State on January 20th, 2020. So, 3 days later. January 29th, the President of the United States established a COVID-19 task force. January 30th, the WHO declares a global health public emergency. This date is pretty important. The CDC identified person-to-person transmission. Also, that's a key point at the end. The U.S. began to create travel restrictions. So this is about the United States' biggest tactics in the beginning of trying to control the spread of COVID-19. And some things that they really seem to focus on when I was making this presentation, or finding my research for this presentation, I should say, was keeping COVID-19 out. They established crisis management teams. They increased medical supplies. And this at the end on March 13th. It's just a very important day because that's when they declared a national emergency. But here's some examples of where they focused on keeping COVID-19 out. The President of the U.S. Puts travel restrictions on China. The President institutes travel restrictions to Iran. The DoD calls for quarantine and testing of the Grand Princess cruise ship. As you can see, they put more travel restrictions on the United Kingdom and Ireland, Europe as well, because Italy was in lockdown, and I'm sure many of us remember how crazy it was over there. There was a lot of people dying, really sad to watch on the news. On March 16th, they finally decided to put in 15 days to slow the spread. And this was implementing all social distancing in all levels of society. And this around this time is when they realized this is what I'm calling the wildfire broke out, because just a few days before that they had only 1,700 cases, and if you look on the database, it just started to spread like a wildfire. The cases were almost doubling day to day around this time, so I think that's when the government was kind of having a panic attack over this. So they flew out 500,000 COVID-19 testing swabs from Italy. So this is going over some things that I see as positive things that they did. They established coronavirus incident system by January 7th, 2020. This was just shortly after the discovery of COVID-19. It was less than a month, and really it was about just actually like around a week after they realized like this might be a big problem. As I mentioned before, they started screening in 3 major cities by January 17th. This was before there was even a case of COVID-19 in the U.S., so they really did try to keep it out. The same thing with the cruise ships, they tried to keep it out. Military travel restrictions were put into place, and that was to try to stop the spread all over the world. And people coming home from the military to the U.S. from certain areas were having to quarantine as well. Task force were established within the first 2 months of the discovery of COVID-19, so they were paying attention to this, and they did make moves to try to prevent it. As transmission spread, they banned travel from high-case areas, and I mentioned this is also a negative in the next slide. They quickly received PPEs and tests when they realized the severity of the situation. As I mentioned before, they ordered in 500,000 tests once they realized the severity, which was around March 16th. Quarantine was put into place from outsiders coming from high-risk areas. I guess I state that twice. Going to have to change that. They put in social distancing measures on March 16th, 2020. And again, this is when they realized it was a wildfire. So here's some things that I found important that I noticed that they didn't do, in my opinion, and maybe they should have. So the CDC waited until April 3rd, when there was over 100,000 cases, to recommend face coverings. And I mentioned that they knew it was spread through respiratory droplets. And this is because they released the initial forced health protection guidelines stating that doctors should be wearing PPEs. And they knew it was also a respiratory virus. And at this point, they had already confirmed that it was a person-to-person transmission. The U.S. did not put in quarantine restrictions as well as they could have. And I'm going to use myself as an example and a witness, because I couldn't actually find my research on this very well. But I was in Canada, and I traveled back from Canada in October. I'm a U.S. dual citizen. So I called a bunch of places, the border, the New York State Department of Health, and there's one more thing which I cannot remember the name of for the life of me. But it was basically, on the U.S. government website that said these are the people to call. And all three, mostly, I was directed to New York State Department of Health. I was told it was their jurisdiction to decide whether or not people had to quarantine. So they told me I didn't, because it was an area where there weren't too many cases, although it was quite a bit. I traveled through Ontario, and at this point in time, they had about as many cases as they did in New York City. New cases daily, that is. There's over 1,000 new cases daily. So I think if they had made people quarantine a bit more, then it could have helped prevent the spread of it. Social distancing wasn't implemented until March 16th, as I said before, after the wildfire began, and there was 17,000 cases at this point, and there weren't enough tests to monitor COVID-19 at this point either. So there were still people coming in from different countries, and they weren't all being able to be tested. The citizens weren't able to be tested. So I think maybe if they had kept some people out for a while, that until they were able to monitor the situation better, then it definitely could have brought down the spread. So here are just some key points. As I said, a positive thing they did is they did set travel restrictions as it began to spread more and more. The more countries that had it, especially high case areas, they stopped people from traveling from there. It definitely helped. And when they realized the severity of the situation, they tried to stop the spread. They made people wear masks. They excuse me. They put in more travel restrictions. They put up social distancing rules, closed businesses. Of course, we all know that. But they just waited for the wildfire to break out. And as I said before, they knew it was person-to-person transmission virus, and they waited to do all of that, though. So, yeah, that's basically it. I think I'll have to learn how to summarize a bit better and organize my speech. Please let me know if you have any tips. I would really appreciate it. I'm definitely not the best speaker, so hopefully I didn't do too bad of a job. And there's my works cited page. I might need a little guidance on that. I did send an email, so hopefully you'll be able to get back to me. Thank you.